When you come to Austin Vein Specialists, we always ensure that you get a thorough workup to see what all of your treatment options are. Typically with varicose vein disease, that includes a thorough physician examination documenting the location and size of the veins and whether they're on one leg, both legs, whether they involve just the upper, lower, or the feet and the ankles or everything. Once that exam's done, the next step in varicose vein patients is 100% of the time doing an ultrasound to evaluate their deeper vein circulation. The reason is that the majority of patients with varicose veins do have an underlying vein disease in their leg, which is referred to as venous reflux disease. The definition of venous reflux disease is that there's an underlying vein problem that doesn't show up visibly to the patient, but is definitely present and causing their surface veins to pop up. And unless you utilize an ultrasound to examine that underlying vein condition, you're not going to effectively treat the patient with the right form of treatment, and you're also unlikely to get the end result that you're expecting. Unless you do an ultrasound to evaluate a patient with varicose veins, you're very frequently going to miss an underlying source of the problem. And if you miss that underlying source, then you're really not going to effectively treat the patient. You're also not going to offer them the correct treatments, and they're very likely going to end up with recurrent problems. That's one thing that distinguishes our practice from other physicians performing vein treatments. A lot of patients have gone to doctors in the past and had vein treatments performed, but unfortunately left a lot of untreated disease beneath the surface that's caused their symptoms to persist or their veins to quickly recur. At Austin Vein Specialists, we always recommend that patients with varicose veins undergo a thorough ultrasound evaluation by a trained technologist, which is reviewed by the physician, to verify that they actually do have treated disease beneath the surface, or to verify that everything's isolated to the surface. Once that ultrasound map has been determined and looked at, then we can make definitive treatment recommendations to cure the problem so that you're not back in a few years with the same recurrent condition.